Flixonase Nasal Spray is a corticosteroid nasal spray containing the active substance fluticasone propionate. It is used to treat allergic rhinitis, including seasonal and perennial allergic rhinitis and certain other nasal conditions. Active substance fluticasone propionate. Indications: Flixonase nasal spray is indicated for the following: allergic rhinitis, including hay fever, seasonal allergic rhinitis, and year-round allergies; perennial allergic rhinitis, nasal polyps. How to use: shake the nasal spray valve before each use, clear your nasal passages before using the spray, insert the nozzle into one nostril, close the other nostril, and spray well inhaling gently. For adults and children 12 years and older, the usual starting dose is usually 2 sprays, 50 micrograms each, into each nostril once daily. For children aged 4 to 11 years, the recommended dose is usually 1 spray, 50 micrograms into each nostril once daily. Your healthcare provider may adjust the dosage based on the severity of your symptoms and individual response. After the desired effect is achieved, the doctor may consider reducing the dosage to the lowest effective dose. Contraindications: Flixonase nasal spray should not be used in the following cases: hypersensitivity or allergy to fluticasone propionate or any of the product's components, active or recent nasal ulcers or nasal surgery. Warnings: use Flixonase nasal spray regularly for the best results, even if symptoms improve. It may take a few days before the full benefits of the medication are noticed. Avoid spraying directly into the nasal septum. Do not exceed the recommended dosage without consulting a healthcare professional. Side effects: common side effects of Flixonase nasal spray may include nasal irritation or dryness, sneezing, nosebleeds, unpleasant taste or smell, headache. If you experience severe or persistent side effects, contact your healthcare provider. If you have concerns about its use or experience unusual symptoms, consult with a healthcare professional for personalized guidance.